I told you I had a full metal jacket and I'm blocked all the way from scar tissue, I guess.
Mm,
And I haven't seen my doctor in it's been over 6 months because I was waiting for Medicare to kick in.
okay.
But so I go and get my scans, ABIs, and what else, blood work and everything, and then I see him next week. So and I'm walking a lot, and I don't smoke anymore. And my diet's like 99% good. It isn't perfect, but my question for you is: so I walk a lot with pain, but like, what are some informed or education, or I don't know what, intelligent questions that I should be asking him? Like, we
Um,
know we're, well, I mean, I'm getting an ABI, but we know I'm blocked up. It's how much blood flow, I guess, I'm having.
well, what I would start with is how are you doing every day? Like, how's your life going? Because honestly, if it's blocked and you're walking to your doctor's office, you're doing better than many. So the question
I'm
is, what
hiking. I'm hiking. I mean, I'm doing
if
good.
you're doing better than I am without a stent? But what I would say is, what is the reason to have to do something right now? I would tell you if you're blocked and you're hiking, I personally wouldn't try to touch you unless you, God forbid, developed a wound somewhere or
Oh,
you're having
he
pain.
isn't. He's not
Okay.
planning on it.
Okay.
I think it's
Okay.
just he's keeping
I
me
see.
monitored, but I'm going
What
to
I,
have consultation with them. So I don't know. Is there something I should be asking or
you
looking
can,
at
yeah,
or
you can ask, say, hey, if I develop something that needs something, what can I do? Are we going to try to reopen this? Do I have a good vein for a bypass? Am I a candidate for a bypass? How does the rest of my vessels look below my legs? Has my ABI gotten better? Where am I? Um, I think those are the things is what's my next step if something does change in my symptoms?
well, he already
Um,
said bypass, but I
oh,
went
all
to a
right.
vascular, I went to a vascular doctor and he said, because I have such good blood flow from collaterals, he said, you don't need it.
Yeah, I mean, you can open up even old occluded stents now. Is that a best option? That's a little hard to tell. If you're high risk for surgery, um, if you were, then I'd say you can always open up something, most likely. If you have occluded bare metal stents, they don't stay open that long once you try to reopen all that stuff that's been chronic for a long time. Covered stents are a little bit easier to open, but then again, they go down hard. So there's nuances to all of it.
He
If
said
if
that I keep scarring. He said, so you're just going to scar again. Do you think
Yeah,
that's right?
I think what he's
Because you're
saying,
so
or
young.
the term he's trying to say is it's what we call hyperplasia, is that if you have bare metal stents, when your body reacts to all the work you've done in there, all touching the vessel, it creates inflammation, and that inflammation lays down all this tissue. That's the scar he's talking about. It's called hyperplasia. So that drug-coated balloon, it tries to fight the hyperplasia. The drug-coated stents, they try to fight the development of that tissue laying down. So that scar tissue is sometimes it's inevitable. Question is, how long does it stay away from growing, and how long does it stay away from causing a blockage or bigger problems?
Right.
Three months.
So that's the scar is the hyperplasia is what he's
Thank you.
referring to. Yeah.
Thank you.